The MUA procedure is commonly talked about amongst knee replacement patients, their physical therapist, and their surgeons. As soon as you start struggling with knee bending, it seems like the MUA procedure is mentioned. So, for those of you who don't know what the MUA procedure is, MUA stands for manipulation under anesthesia. So, this is when the surgeon puts you under anesthesia. So, they put you to sleep and then they go in and they bend your knee for you. So, they don't do any cutting, there's no surgical tools used, but they do have to put you under anesthesia, and then they just pick up your knee and they start bending it, and you can actually hear the scar tissue, or maybe it's soft tissue that is breaking up, and you can hear the ripping of the tissue. So we want to avoid this procedure at all costs. However, it is acceptable for a very select few of people who do struggle with knee bending, who do have that scar tissue formation that does happen. It only happens in about 3% of people, though, so it's not very common. So if only 3% of people truly need the MUA procedure, then why are so many people getting this procedure done? So I personally think it's because it's such an easy procedure and it is so effective that they recommend it all the time. So again, nothing is cut open. They just put you under anesthesia. Very easy, quick procedure for the surgeon to complete. But for the patient, it's not such an easy, quick procedure. Again, you don't want to be put under anesthesia for no reason. There are risks associated with that. And then after the MUA procedure, you might get full range of motion on the first couple days, but then that swelling starts to kick in just from the procedure itself. There was ripping of tissues. There's a huge inflammatory response that happens after an MUA procedure, and you have to do physical therapy every day to really get that swelling under control, the inflammation under control. You have to do the right exercises, you have to do the right stretches, and you need the correct guidance for the MUA procedure to go well. So real quick, for those of you who don't know me, my name is Dr. Samantha Smith. I am a physical therapist and a knee replacement specialist. So my YouTube here is dedicated to knee replacement recovery tips and tricks, my Instagram, my TikTok. Please go follow me there. And I have a Facebook group. It's a free support group with thousands of members in the group. So if you're needing support from other people going through the same exact thing you were going through, please join my Facebook support group. You'll just search Succeed with Your New Knee on Facebook. Another thing is I have a website dedicated again to knee replacement recovery tips and tricks. My website is succeedcourses.com. You can schedule phone consultations with me. I have knee replacement courses and exercise classes. We have 5-star review, really great results with my exercise classes and courses. So if you are struggling, you need more assistance, please sign up for one of my courses. You will not regret it. So the topic of this video is how do we avoid the MUA? So first and foremost, from my experience as a physical therapist, you need to do the right exercises from day one. I also believe that you need to start physical therapy day one after your knee replacement. A lot of people aren't starting physical therapy the first day. In the Facebook support group, there are people in the group that are waiting, 2 weeks before they start physical therapy. Then they get to therapy and their knee is just so stiff, so swollen that they kind of start off on the wrong foot, making that knee bending way more challenging. So you have to do the right exercises from day one. You need that professional guidance. Another thing to keep in mind is if you are doing too many exercises too soon, you're getting too much aggressive physical therapy, that's going to set you back with your knee bending as well. You need to start out slow and steady. We don't need to be putting resistance bands on you week one. You don't need to be lifting weights week one. You don't need to be walking a mile and a half with your dog the first week after surgery. I know they tell you to keep moving and keep exercising, but we have to do it slow and steady. So the more you do, the more swelling you're going to have. And it is so important to manage that swelling so you don't have a challenge with the knee bending. So that is where I see most people go wrong. They just don't have the right guidance with their physical therapy. They go to their physical therapy appointments, they follow all the instructions, they do everything they are told to do, and they still have problems with their knee bending. Why is that happening? Well, you're probably doing too much. Your therapist is probably giving you too much to do. They're probably stretching you too hard, and they're not helping you manage that swelling. So, in my knee bending course, this is exactly what I focus on. Let's manage the swelling, let's manage the quad tightness, and get that quad muscle to relax as much as possible. That way, it's so much easier to bend the knee, and then you don't need the MUA. Another thing that I see happen is a patient will do really well in the beginning of their recovery. Those first 2 to 4 weeks, they get to a really great number with knee bending, maybe 110 by 4 weeks, which is really great. And then they start doing a little bit too much activities, of daily life. They start doing a lot of chores, a lot of shopping, getting back to their job, walking their dog again. They just start doing what they want to do after their knee replacement. And then that swelling, that soreness, that tightness just rushes back in because the body, the knee just isn't ready to do all these activities quite yet. So that is another reason why people get that increased tightness. The range of motion decreases when this happens. And then their surgeon, their physical therapist starts mentioning the MUA again, saying, hey, we don't know what to do. You're kind of getting stuck at a certain degree. You're not making any progress. You're actually getting worse. We think the MUA would be best for you. And I personally think that is not the answer. We just need to get you on the right program to help you decrease some of that swelling, get you on a good program to help you ease into activities, ease into exercises and stretches. And then if you don't make progress with that, okay, let's talk about the MUA. So again, that's what I teach in my knee bending course. I have you really focus on decreasing activities. Let's get that swelling down. Let's get that muscle tightness down. Let's get that quad a little bit less mad at us, and then we can start to bend the knee. As a patient, you are not expected to know how to get through your knee replacement recovery. That is your physical therapist's job. That is our job as the professionals, as the experts in movement science, in exercise. We are supposed to guide you through this process. Not only are we exercise experts, but we are also experts in how to educate you on managing swelling, managing pain, and managing your inflammation. So those are key to improving your range of motion and decreasing your risk for the MUA procedure. So if you aren't receiving that guidance from your physical therapist, please reach out to me. Let's chat via email and figure out what we can do to kind of switch up your plan. That way we can get you on the right track. Again, I do have the knee bending course. That is usually what I recommend. But if you ever need some more personalized support, I have one-on-one coaching, and I also do phone consultations. So please feel free to reach out to me at drsam@succeedcourses.com. Thank you so much for watching this video, and I'll see you again next time.